Mr. Smith? Hi, my name's Elizabeth. I'll be your nursing student today, and it sounds like we are going to be doing a physical assessment on you. Verify that this is a good time to do so. Verify physician's orders, and could you tell me your full name and date of birth, please? Yes. Check the name band for name and date of birth. Okay, perfect. And I would have assessed you walking in, sitting down. It looks like your gait was okay. Do you use anything as far as assistive devices like a cane, a walker, anything to that nature? Okay, perfect. So we're going to get this out of the way here. And see, I would have sanitized my hands when I walked in here. Okay. And then are you experiencing any pain today on a scale of 0 to 10? Okay, very good. What I'm doing, I'm just going to sit you up in bed if that's okay here. And you don't have any issues with sitting upright? Okay. All right. So what we would do first is, again, we're going to be doing a physical assessment for you. So it's just kind of like a head to toe assessment, just get a check on everything. It's nothing that should be painful or cause you discomfort. So it's just me taking a look at everything. Okay, so we'll, like I said, do a head to toe. So we'll start with your head. I would assess hair for any pediculosis or infestation, see if there's any balding spots. It looks like everything is good there. We would assess your ears next, so we'll take a look if there's any wax buildup. And then do you wear hearing aids or have any issues with hearing at all? Okay, good. So what we'll do next is I'm just going to assess your eyes. So what we would assess for is something called perla, so that would be your pupils are equally round, reactive to light. And just look straight forward and we'll do that. Reactive to light, very good. And then accommodation. So you'll watch my pen light and just with your eyes here. So just very good. Assess here, very good. Okay. And then we'll make sure that there's eyes are symmetric, no concerns there. Ears was symmetric as well. And then as far as your nose, we'll take a look in your nose here. Make sure there's no concerns, deviated septum. Okay, we're also just going to check your mouth now. So I'm going to look at your teeth, your gums, tongue, throat, make sure all of that looks good, which it does. Perfect. All right, I'm just going to feel your lymph nodes here. So just check those out, make sure they aren't enlarged, make sure trachea is midline, and then I'll check your carotid pulse, or this pulse that's in your neck here. So that's all good there. And then can you just rotate your head left and right for me, and we're going to check for JVD. So we'll do that. Perfect. And what about shrugging your shoulders? Can you shrug your shoulders? And what about your arms? Move your arms around with no issue like that. Very good. And so yes, at this point we would, listen to heart sounds is what we'll do. So I'm just going to unpin this here so I can just be on your chest. And okay, so just listen to your heart sounds here. So we'll go to your right side, second intercostal space. That is your aortic valve. Left second intercostal space, pulmonic. Erb's point is third. Tricuspid would be fourth. And then mitral is your fifth intercostal space, mid-clavicular line. And I would listen to those for a full minute. And then also for your breath sounds too, I'll just have you take normal breaths here. And we'll go here. Here. Okay, very good. And at this point, I would listen to breath sounds in the back as well. So we would start on left upper shoulder, move over to right upper shoulder, down on right lower shoulder and over and back. So that would be 7 times going back and forth, and then there would be 2 lateral breath sounds that I would listen to as well. So, perfect. All of that sounds great. We're just going to lay you back down here, and we're going to check out your stomach. Are you having any abdominal pain, discomfort, any concerns with urination or bowels? Okay, very good. And for bowel sounds, we'll do right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, perfect. So you said no concerns with eating at all, so you don't have any problems with eating. And then also I forgot to ask if you have dentures, any other concerns with your teeth at all. Okay. And then what about any difficulty, pain, swelling in your legs at all? Okay, so I'm just going to look at your leg here. And so just feel for any swelling. We'll check pulses. Okay. We'll assess your nails and do capillary refill in your feet and your hands. So those look great as well. Okay. And let's see here. Okay. And then, so as far as pulses, we would check your carotid pulse like we did, check your brachial pulse, your radial pulse. We did the pedal pulses, so those are great too. And then turgor, we would check on your hand or your chest. So this, just depending on age. Check that. Perfect. Looks great. Okay. I'll just sit you back up here. Make sure there's nothing that I missed there. Let's see. Okay, perfect. I believe that is it as far as the physical assessment. Let us know if there's anything else that you need, and thank you very much. I feel like I forgot some, but that's all right.